Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over Hydrofera Blue. So how to apply it and how to remove it. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel reach more people. So let's get started. Okay, so we're going to start with the sheet because we're going to talk about 3 different applications. So the sheet, as you see here, the tunnel tube, and also the ostomy ring. Okay, so as always, clean, wash your hands, clean gloves on. Okay, cleanse and irrigate the wound with normal saline. Okay, this dressing, it can be cut. Okay, so it can be cut to fit inside of the wound. It's kind of used as a packing in there, and it has an antimicrobial on it. So this is something that you would use for wounds that do exhibit signs of a local infection. You can also use it for signs of deep spreading infection, but you would also need an antibiotic with that also. Okay, so this sheet is hard. Okay, hard, like a hard cardboard. So you have to moisten it with sterile saline or sterile water. Okay, and also during the duration that is on somebody, you don't want it getting hard. Okay, so we're hoping that there's enough exudate to keep it moist. Okay, we do not want this to be getting hard. It will cause damage. It will cause damage to the wound if this gets hard. Okay, we do need it just moistened so it's soft, so it's almost like a sponge. It'll then be a sponge. Just you're going to squeeze it out with either forceps or sterile gloves. Okay, and you're going to apply the dressing to the wound bed. Okay, so you're going to put it right into the wound bed. Now this is normally for wounds with some depth to it. Okay, it's about, I would say 2 to 3 mils thick when it's moistened. So it does go into the wound. Okay, it gives that layer that fills that dead layer that we need to be doing. Okay, then we're going to be applying the appropriate cover dressing over top of it. Okay, the cover dressing will allow more moisture to be absorbed and to just keep this sponge at the appropriate level. Okay, when this is done being used, it'll be white. Okay, so all the antimicrobials, it'll be absorbed, and then it actually turns white. That's how you know. That's like the indicator for it to be changed. Okay, now same thing goes with the tunnel tube. Okay, you just moisten the end and it'll just soak up through here. You're going to squeeze out any excess, okay, because you don't want it sopping wet. You just want it just wet. And then you're going to gently pack the tunnel with the tube. Okay, you're going to allow at least 2 centimeters of visible tail out of the wound. Okay, you know what I mean by that? You have the wound is here. Okay, say this is the wound. Okay, you put the tube into it. You want to have this hang over here. If you don't have that hang over, it could get lost in that wound and it's really hard to get out. So you always want oh, sorry, it switched on me here. You always want a good tail out of the wound. Anytime you're packing a wound, you want a good tail, at least 2 centimeters, so it can be pulled out easily. I have seen it where I don't even know what happened because it wasn't me who had packed it. But obviously there was not a big enough tail and it got sucked into the wound through movement or whatever it might be. And it got sucked into the wound and it was very, very hard to get out. Okay. It's just a source of infection if it's left in there too long or we can't find it. We got to send people for scans to see did it fall out? Is it there? Like what's going on? So always have that tail. And then once again, an appropriate cover dressing. And then the ostomy ring. So the ostomy ring, you're going to cleanse the peri-wound, peristomal area. You're going to pat that area dry. You're going to cut the ostomy ring to fit in here, okay, where it fits appropriately, so you can fit the stoma through here. And then you're going to place the place the film, so the shiny side of the ring, onto the appliance. You're going to smooth this into place, okay? There is no moisture needed for this ring to be here, okay? You don't need any moisture. You just put that on there, shiny side against the ring of the ostomy, okay? And then removal. Gently remove the dressing with forceps. If the dressing has adhered to the wound bed, rehydrate with sterile saline or gentle water and remove gently. You got to be careful with this, okay? This is only for wounds with moderate to heavy amounts of exudate. We need to make sure that there is enough exudate here coming from the wound that this isn't drying out. If you're having issues with this, change to something else, okay? Frequency of change. So you're going to monitor daily to assess if the dressing has turned color from blue to white. Like I said, that's the indicator that it needs to be changed. If the dressing has retained the blue color, then leave it in place for another day, okay? When it's lightened, then switch it out. The dressing can remain in place for up to 3 days. For ostomies, though, just change it whenever you change the appliance. Okay, the expected outcome is exudate is managed without peri-wound macerations. Okay, so no peri-wound maceration. That's because we have a lot of fluid. We don't have that white ring. And signs and symptoms of infection are resolved within 2 weeks. So that'll be your local infection that's resolved within 2 weeks. Okay. So I hope this video did give you a better understanding of how you would apply Hydrofera Blue to a wound. But that's all I have for today's video, guys. I hope to catch you in my next one. Bye for now.